Hi, I'm Krista Hughes, the founder and CEO of Hughes Advocacy, in which I'm a board certified patient advocate. I'm also an educator at the Leapfrog Judy Burroughs Education Institute, which is the educational arm of the Leapfrog Group. Leapfrog is an independent nonprofit organization that rates hospitals and ambulatory surgery centers on how safe they are for patients. Today, we're going to cover what is a diagnosis, the different ways that it sometimes can go wrong, why getting the right diagnosis matters, and most importantly, how you can play an active role in making sure you get the best possible care you need and deserve. And this is especially important for those who are over 55 years old and up, as you usually have more than one doctor. So first, what is a diagnosis? A diagnosis is simply the name or a label your doctor gives to explain what's causing your symptoms. For example, if you've been coughing for a few weeks, a doctor might diagnose you with bronchitis. If you felt extra thirsty and tired, you might hear type 2 diabetes. A clear diagnosis points to the right treatment, whether it's medicine, therapy, lifestyle changes, or sometimes some more tests. So now let's talk about the three main types of a misdiagnosis. Unfortunately, diagnoses aren't always perfect, and there are three common kinds of misdiagnosis. Number one, there's a misdiagnosis, and that is there's a condition there, but the doctor does not recognize it. For example, thinking a persistent headache is stress when it's actually a sinus infection. Number two, a wrong diagnosis. That's when you get a label or a diagnosis, but it's the wrong one. For example, treating chest pain as acid reflux when it's really a heart problem. Number three, a delayed diagnosis. And that's a correct diagnosis happens, but after a delay. For example, dismissing your early warning signs of diabetes for months, allowing complications to develop. Each of these can lead to treatments that don't help or even do harm and can cause delays in getting you the right care. So why does this matter? Getting the right diagnosis quickly is vital because of the speed of treatment. The sooner you know what's wrong, the sooner you can get the right treatment. It is avoiding harm. Wrong medicines or procedures can make things worse or cause side effects. And peace of mind. Understanding what is happening helps reduce anxiety and let you plan for your health. For example, Susan thought her back pain was just part of getting older. 6 months later, she learned she had a treatable spine condition. She had 6 months of unnecessary discomfort that could have been avoided. So, how can you be involved? You are the most important member of your healthcare team. Here are 4 practical steps that you can take. One, prepare for your appointment. Write down your symptoms, when they started, how often they occur, and what makes them better or worse. And list all of your medications and include vitamins and supplements. Number two, speak up and ask questions. If something doesn't make sense, ask, can you explain that in a different way? Ask about alternative diagnoses. Could this be something else? Number three, keep records and follow up. Bring copies of past test results, imaging scans, or notes from other doctors. If symptoms don't change or improve, schedule a follow-up appointment immediately. Number four, seek a second opinion when needed. It's okay to say, I'd like to get another opinion, because many hospitals and clinics welcome second opinions to ensure accuracy. So here's a quick real life example of a misdiagnosis that I would like to share. Maria, a fictitious name, had frequent stomach aches. After 3 different doctors told her it was stress, she asked for a CT scan and insisted on blood tests. It turned out she had gallstones. Once they were removed, her pain disappeared. And Maria's willingness to ask questions and request these tests, that's what made all the difference in getting her the medical care she needs and deserves. Your health is too important to leave to chance. By understanding what a diagnosis is, recognizing the types of misdiagnosis, and actively participating in your care, you greatly improve your chances of getting the right answers the first time. Remember, write down your concerns, ask your questions, keep good records, and never hesitate to seek a second opinion. Your voice matters. So speak up, stay informed, and partner with your healthcare team every step of the way. Thank you for watching this video. For more resources, please visit the Leapfrog Judy Burroughs Education Institute. And if you have any questions for me as a patient advocate, please reach out to me via my website at hughesadvocacy.com. Thank you and have a great day.